Good morning. My name is Paulette Shaw, and I'm a research fellow at the Public Policy Institute of California. Thank you for tuning into our program today, featuring findings from a recent PPIC report, Healthcare Access Among California's Farm Workers. I would like to thank the PPIC Corporate Circle and the PPIC Donor Circle for supporting today's event. I will present key findings from the report and then moderate a discussion with a panel of experts. The report, policy brief, appendices, and the slides from today's presentation are all available at ppic.org. A few notes before I start. As a reminder, PPIC is a public charity and does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. At the end of today's program, we have set aside some time to answer audience questions. If you have a question for our panelists, please send an email to the address on the screen, ppiceventquestions, all one word, @gmail.com. We would appreciate your including your name and organization along with your question. And with that, let's begin. I'm presenting findings from my new report on California's immigrant farm workers and their access to health care. Farm workers in California are largely immigrants, and my study focuses on the 90% of farm workers in California who are immigrants. From here on, all of the findings I present are for this group. In California, cost or lack of insurance is a key barrier to healthcare access for low-income immigrants, as past studies by PPIC and many others have shown. But most of California's immigrants are concentrated in urban areas, and farm workers' lives are likely to be quite different. They could have other barriers to care, including having to travel long distances to providers, lack of transportation, or other challenges different in the environment where they live and work. There are several large policy changes in recent years that could have affected farm workers. The Affordable Care Act, known as the ACA or Obamacare, included a number of provisions that could have increased insurance coverage for this group. A couple of these are especially likely to reach farm workers, many of whom are low income and all of whom are working. The 2014 expansion of Medi-Cal to most low-income adults greatly increased Medi-Cal's reach in California. The program now covers a third of residents. And over the 2015-2016 period, the ACA employer mandate was rolled out. This provision required large employers to offer affordable insurance to their employees. Undocumented workers can be covered by employer insurance, but they have typically been ineligible for Medi-Cal until recently. A series of state Medi-Cal expansions have allowed undocumented children, young adults, and most recently, older adults to enroll in the program. This study has several goals. It analyzes changes to farm workers' demographic characteristics. It describes their barriers to healthcare and their insurance coverage types, and it analyzes how those barriers and coverage types change relative to large policy changes. I used two data sources. The National Agricultural Workers Survey, or the NAWS, is a Department of Labor survey of crop farm workers who are not on guest worker visas. I interviewed several experts to discuss topics not covered in the NAWS, including the challenges of the COVID-19 pandemic. Interviewees included ag employers or membership groups, a farm worker advocate, a physician serving farm worker communities, and a health insurance nonprofit focused on farm workers in the produce industry. Here's one example of how the demographics and the profile of farm workers has been changing over time. California's documented farm workers, who make up about 40% of the group, have had a relatively low and consistent rate of traveling here or internationally shuttling from abroad to work on farms. Undocumented farm workers previously, as you can see from the graph in the navy line, previously had higher rates of traveling for farm work, but in recent years, their tendency to travel has converged to look like the more settled documented farm worker pattern. So the reduced travel pattern is really driven by changes to undocumented farm workers patterns. Another thing that's changing, and surely related to the more settled lives of farm workers, is the fact that they are increasingly more likely to live with their spouse in the US. Farm workers are mostly men, I should mention. The trend is true for both documented and undocumented farm workers. And home base is now California, rather than Mexico or Central America. And as farm workers have become year-round residents, they have also been aging. The average farm worker is now over 40 years old, an age group with growing healthcare needs, including recommended screenings at certain ages and some chronic disease management. And while my study focuses on farm workers' access to healthcare, the shift towards settling and living here with families suggests that there are broader questions of farm worker health needs that include women's health concerns, prenatal, and pediatric care. So first, let me just start by saying that most farm workers are getting some health care, and most of them are getting that care in the United States. It is not shown here, but the majority of those getting care in the US most recently went to a community or migrant health clinic or a doctor's office. Still, a substantial proportion does not get care over a 2-year period, and the bars indicate that a larger proportion of undocumented workers did not get care. So what are farm workers' barriers to care? Much like immigrants across the state, as it turns out, cost or lack of insurance is the most frequently mentioned barrier to getting health care. This is true for both documented and undocumented farm workers. Immigration status, while frequently a reason for being ineligible for programs like Medi-Cal, did not rise to the same level of importance for undocumented farm workers in terms of salience as a barrier to healthcare. Barriers like transportation or not knowing where services are available were rarely mentioned, even though farm workers are in less urban areas. So then the question is, if cost or lack of insurance is the biggest barrier to care, did the policy changes that I discussed earlier coincide with increased insurance and reduced barriers? This graph just shows documented farm workers. As it turns out, although undocumented status is infrequently cited as a barrier to care, it does predict very different outcome patterns for farm workers. So first, let's discuss the documented workers. They make up about 40% of immigrant farm workers. And following the 2014 Medi-Cal expansion, there was a clearly correlated increase in Medi-Cal coverage. So you can see that in the navy line, and the dotted navy line indicates roughly when that expansion occurred in this time series. The employer mandate, however, does not correlate with coverage gains. So I've indicated in silver when that started to roll out in 2015 and 16. And also these are fiscal years, by the way. All of the years shown in this study are fiscal years. And finally, it's not shown in this graph, but the Medi-Cal expansion timing also correlates with a decrease in concerns about cost or lack of insurance for this group of documented farm workers. This is the analogous graph for undocumented workers. For this group, neither the Medi-Cal expansion nor the employer mandate clearly correlate with insurance gains. There's an uptick in overall insurance, but there are no clear patterns associated with the policy changes in the statistically adjusted analyses. Both of the graphs that I'm showing you are simple trends, but there are underlying, more sophisticated analyses presented in the report that I will not be covering in today's presentation. Similarly, there are no clear correlations between the timing of the two ACA policies and concerns about cost or lack of insurance for this group. Again, the most salient barrier to care. So the NOS survey data go through fiscal year 2018, and that's before the state Medi-Cal expansions to young adults or older adults. So for this time series, only undocumented children began to have access to Medi-Cal through state policy changes. But children, as you can see, make up a very small percentage of farm workers. They're that lower dark orange group. Young adults also make up a small percentage of farm workers in the navy in the graph. Older adults, ages 50 and up, are about a fifth of undocumented farm workers. So this group, if they meet income limits, they can now access Medi-Cal as of May of this year. However, the largest group of undocumented farm workers, ages 26 to 49 in the light green, remain ineligible. Of course, most notably, farm workers are essential workers who have helped meet our food needs during the COVID-19 pandemic. Given the time frame of the NOS data, I used interviews to fill in some of the gaps about the pandemic period. In addition to virus concerns associated with work, Experts mentioned that the home can also be a source of risk for workers. Crowded living conditions due to a lack of affordable housing, which of course is a theme throughout the state, make it difficult for many farm workers to isolate at home when they are exposed or ill. Additionally, one-size-fits-all vaccination efforts have not been the best way to reach farm workers, and they benefit from special outreach that finds them where they are, which is often at work. And importantly, the work is physically demanding, and even low levels of disability due to long COVID could threaten farm workers' capacity to work. So that's a lot to think about on the topic of the pandemic and threats to farm workers. Let's now turn to a panel of experts to expand on the topic of farm worker health during the pandemic. If you have a question for our panelists, please send an email to ppiceventquestions@gmail.com. We would appreciate your including your name and organization along with your question. Now I'd like to introduce our panelists and have them join me on screen. First, I'd like to welcome Assemblymember Dr. Joaquin Arambola, representing District 31. Estela Cisneros, Legal Director of the Agriculture Worker Program at California Rural Legal Assistance, or CRLA, a nonprofit law firm serving low-income residents in rural counties. Teresa Keene, President and CEO of AgSafe, a nonprofit industry-supported organization that provides education to agricultural employers, supervisors, and farm workers on issues of worker safety, human resources, pesticide safety, and leadership development. More details about our panelists can be found on the PPIC event page. Welcome, panelists. Thanks so much for joining us today. First, let's start off by discussing how COVID fits into the existing health and safety landscape for farm workers. What were the most pressing challenges to farm workers' health and well-being before COVID-19, and how have these changed during the pandemic? Let me turn to Ms. Cisneros to give the first response.
Thank you. Thank you so much for having me. For us, our experience was that the healthcare access issues that farm workers had before the pandemic were exacerbated by the pandemic in terms of the extent of the high rates of COVID-19 amongst the farm worker population. Of course, that also includes all frontline workers for the most part. They had very high rates of COVID infection, as well as particularly deaths. There was a study recently that showed that there was a very high incidence of death related to COVID amongst frontline workers, presumably because they were not able to telecommute or to work from home. They were working in person throughout the entire pandemic. And so it really showed us the pre-existing problems, how difficult it is for farm workers to access healthcare due to several reasons. There are physical isolation, language access issues, as well as just the higher incidences of COVID infection in the workplace.
Thanks so much. Ms. Keene, Dr. Arambola, would either of you like to respond to that? Ms. Keene?
Sure, that'd be great. Paulette, thanks again for having me, and it's a pleasure to join this panel. So I would say here in California, we actually had kind of a leg up in terms of occupational safety and health prior to the pandemic. As we are required to have an injury and illness prevention program, we really had a foundation for creating safety programs. And so when COVID hit, we kind of were able to have that baseline and then layer on top of it all the things that we needed to change in order to keep our workers safe. So prior, we were talking about heat illness prevention, pesticide safety, tractor safety, all of those topics. And then when COVID hit, it was really not interesting, but we would have these conversations about, what you do at work, but now we're having the conversations about what happens at home as well, which was really an interesting place that we had never been before. And so it really did change in how agricultural operations had to operate.
I'll add, if I can, early on in the pandemic, UC Merced's Labor Center did a survey speaking with many residents in the Central Valley. And a Tulare County resident's comment stuck out then, and it still resounds with me now. They said, we either die of hunger or we die of COVID. The social determinants of health that too often face our farm worker communities who are struggling to put food onto their table and to keep roofs over their head led many within our community to make that tough choice to continue to show up as essential workers. And I believe it's important for us to make sure we're addressing those social determinants of health, those factors outside of the four walls of healthcare, to make sure we're adequately addressing the real needs of our farm worker communities. How do we make sure that they are in housing that is supportive for multi-generational housing? How do we address the food insecurity, which is so ironic coming from the breadbasket of the world? How do we make sure we're really addressing those social drivers so that we can effectively make change for our communities and have better outcomes? I hope those are lessons that we've learned, and believe that we are starting to address resources towards those issues. And I'm grateful that we've had the opportunity to work on it, but know and believe that they were exacerbated during the pandemic, that our communities who were vulnerable, who were on the front lines, had to make those tough choices for themselves and their families, and they bore the brunt during this pandemic as well. I believe we need to recognize that and appreciate that, but also then resource and support those same very communities.
Absolutely. That's great. Is there anything that Ms. Cisneros or Ms. Keene you'd like to add in response? Great. And we'll get to a discussion of those resources, Dr. Arambola, as well. I think that is on a lot of people's minds, both in terms of federal and state investments, all the way down to what's happening boots on the ground at the local level. And actually, great segue, because I wanted to talk to you next about vaccination efforts. So employers, nonprofits, healthcare providers all played roles in vaccinating farm workers against COVID-19. And of course, it felt like we did that and everything was fine, but it now appears that ongoing booster shots are needed. And so my question is, how do we continue efforts in this space? Ms. Keene, could you start us off?
I'd be happy to. So AgSafe, we were really fortunate in the fact that we had some additional support through the Western Center for Agricultural Health and Safety, and through a contract through the state of California to really provide a lot of outreach and education to our ag employers. We know that our workforce, again, we were essential workers, and they were there every day. And so for many of those ag workers and our ag employers, there's some really strong relationships there. And we've got ag employers that have had employees that have been with them for generations, for 30, 40 years. And so a lot of our ag workers were looking to their ag employers for help. And I'm really excited that, we were able to answer the call. We had a couple of growers that were in the Fireball region, which communicated directly with their local health department, and their local health department, they created this collaboration and did a fantastic drive-through vaccination event. Early on, hundreds of people were able to get vaccinated along with their families. One of the best pictures, I wish I could have showed it, was this line of cars going through and people getting vaccinated. And also the employers waited as well to get the vaccinations with their employees. So we've had these massive events that have happened thus far. I think moving forward, though, we're going to have to be flexible and pivot. And I feel like when we were looking at the state, and we were getting calls from all over our agricultural communities about who do we talk to? Some health departments were able to help. In other situations, we turned to community clinics to help, and having conversations at the local level about what's available? What do you guys need? Can you get the vaccinations out to our fields? Because when we're able to do that and reduce down those barriers for our farm workers, that's when we have success. And so hoping that we can continue to do those kinds of things as we're talking about boosters. And again, just continuing to talk about COVID and making sure that people are still doing what they need to do to protect themselves, because it's still with us and we are still impacted by it. And especially this essential workforce. The other thing that I would also like to say as well is, in addition to vaccinations, testing has also been really critical to ensure that we catch things early on, rather than having somebody come to work who may not know that they're infected or have COVID. And so making sure that we have those testing resources available. There were a couple of points during the pandemic where it was really, really difficult to find tests. And when you did get tested, it took a week for your test to come back. And so if you were positive, you could have just infected the rest of your family. You could have infected coworkers. And so that was a huge concern. So in moving forward, making sure that we still put those resources to testing, and then also our boosters as well.
I'll follow up if I can. I really liked the comment of meeting people where they're at. So often we have to get out of our ivory towers and make sure that we're getting out into community. And so I'd like to uplift some of the partnership that occurred during the pandemic with many of the community-based organizations that I worked with here in Fresno County. For those of you who don't know, I represent half of Fresno County, 14 cities: Fresno, Kerman, Firebaugh, Mendota, San Joaquin, Huron, Coalinga, Fowler, Selma, Kingsburg, Parlier, Reedley, Orange Cove, which are all my incorporated cities. But it was in my unincorporated areas, places like Layton and Lanier and Biola and Delores and Cantua Creek, that I was in during the pandemic early on, helping to administer vaccines. But it was the CBOs who were those trusted messengers, the boots on the ground, who were knocking on doors and bringing people out to community events, that allowed us to vaccinate 10,000 farm workers early on in the pandemic. But it was meeting people out in community, not asking them to take a day off to travel into the urban center, not asking them to come up with funds to pay for gas or any barriers we could. We were trying to actually make sure we were meeting people where they were at, and really am grateful for that. Just in a single picture, this one that's above me is actually Delores Huerta, who I had the opportunity to vaccinate early on in the pandemic in Delores in Fresno County. I believe it's important for us to make sure that we are out in our rural communities, and I'm grateful that those CBOs were helpful right there at the beginning, and believe that they will be necessary as we go forward. Would elevate, if I can, the Health for All movement that we've been working on, and a bill this year, 2680, will help us to continue to support those CBOs, to help us to start to enroll and navigate people towards enrollment into Medi-Cal. Believe that we need to continue those supports to those community-based organizations. And again, I'm just really grateful for all those partnerships.
If I could comment. Thank you, Dr. Arambola, for recognizing the community-based organizations that helped bring people to vaccination sites. My organization was one of those. We got funding to be able to do that outreach. Something that I wanted to comment on was the way I see it is there's two different parts to not just COVID and healthcare and how it affected farm workers, but also vaccinations. One is kind of what happens before somebody goes to work. So pre-existing health conditions, like Dr. Arambola mentioned, socioeconomic factors that exacerbate negative health outcomes. But then there's also what happens at work. Ms. Keene mentioned working with ag employers, thankfully, and the Cal OSHA regulations that were in place before COVID, but the state also, Cal OSHA also put in place some very strong but very contested protections specific to COVID. There was a lot of comment, it took a big push to be able to put some of those stringent requirements in place to protect ag workers when they're at work, right? Related to that as well, of course, is what happens once they do get sick. What kind of employment and income protections, if any, exist in order for them to be able to stay at home, recover. And so then that's where, some of the assistance from that's both in the emergency temporary standard, as well as some state laws that were passed that required employers to provide pay for workers that got sick. And then there's also what happens if there's farm workers who get COVID from work. That's where workers' compensation comes in. There was also some legislative efforts for that, and that was passed. And then finally, vaccinations, right? Boosters. There was a lot of mistrust in the community about vaccines. Are they safe? Will they do this? Will they do that? And CBOs really, worked hard to pass on the message that they are safe, that they don't cause XYZ negative health outcomes. And in combination with all the other efforts that were already in place, it's really something that is going to long-term, protect the farm worker community, as well as all our other communities as well. So it's a very complex, multi-stage process.
Absolutely. Thank you for all of those perspectives. That's really great to hear all of the different players coming together to make this happen, because, despite all the different stakeholders having their own interest, it seems that there was really a shared desire to get farm workers to the front of the line for shots and to put their health first. And I also know about there were a number of efforts to try to get opportunities for farm workers to isolate if they did actually fall ill. And I had heard from others that they were kind of a mixed bag in terms of how well they were accepted by the workers themselves. But in terms of the vaccine front, it does sound like there was a lot of unity on that. I do want to return to the question that Dr. Arambola mentioned earlier, which is the role of government. So of course, federal funding has made it possible to offer COVID vaccination, testing, and also treatment at no cost to low-income Californians. And of course, that treatment piece is really important given what we know about aging farm workers these days. And as Mrs. Snow said, pre-existing conditions. And this is true regardless of immigration status, but what is the role of state and federal investment in addressing pandemic needs for farm workers? Let me start by asking Dr. Arambola for his perspective.
I'll start by saying that both state and federal dollars were absolutely necessary over the last 3 years to address many of the underlying needs of our undocumented community. I would want to make sure that we acknowledge that it's not one-dimensional support that's needed by our undocumented community, that we oftentimes need to make sure that we're addressing the housing supports, the food supports, the access to clean water and access to healthcare, which are so essential for all of us to stay healthy, are supports that need to continue through and after the pandemic. I will just put it out there as a proud supporter and advocate for comprehensive immigration reform, that many of these issues would be addressed if we could, at the federal level, pass what has long been needed. Until that point, I am proud that California continues its legacy of leading and supporting our undocumented communities, and I'm pleased to say that within the governor's budget, we've already expanded healthcare access to our elders and seniors starting in May, but the budget we're about to pass and sign will give us a path towards health for all by January 1st of 2024. That's the direction that we need to continue to go to make sure that we're providing the necessary supports for all Californians to be able to succeed and thrive. I'm pleased to help to lead that charge at the state level, but know that we need the federal partnership as well.
Great, thank you so much for those comments. And I do also want to mention that although of course we are focused on California, the discussion of comprehensive immigration reform at the federal level has to this point discussed making farm workers a priority group for naturalization and regularization of status. So that is something that would be very impactful for some of the individuals that we're talking about today. Okay. Well, let me turn actually to a very related question. As you mentioned, Dr. Arambola, this past May, Medi-Cal expanded eligibility to low-income undocumented adults 50 and older. Obviously, that period is not in the data that I analyzed, and it's very, very recent. So what do you anticipate the effects will be for older farm workers? Could I ask you to speak to this?
I would love to. It's a great pride to have helped to be in a movement where I've authored AB4, moving our state forward to continue to expand healthcare access for all Californians who call this great state home. For too many people, they have been paying taxes for years and not able to receive some of the same supports and benefits that the rest of Californians have been able to achieve. I'm grateful that after going through this pandemic, that there are lessons learned, that our elders and seniors who have sacrificed so much for us are now going to be supported by us as well. This May, we expanded healthcare access for hundreds of thousands of Californians who have given us an opportunity to succeed and believe we need to do a lot to make sure they have trusted messengers to bring them out of the shadows, to make sure that they can participate and understand that these are California dollars. These are their taxpayer dollars going back to support Californians. I'm proud of this state and the legacy that we had, but it takes real leadership, and want to uplift what our governor has done in prioritizing this as a population who needs to be covered. It has taken a lot of effort and really has been a movement from organizations like Health Access and the California Immigrant Policy Center to be able to get us to this point, but we're not across the finish line yet. We have to make sure that people have access, that there are providers to take care of them, and that we can get the preventative care that we need. I was an ER doctor for a decade, and far too often I saw people who came in the last minutes or seconds of their life and knew that there was so much more we could do for our undocumented community in advance if we could get them health care. It's one of the drivers that brought me here to our state capital, and I'm grateful that we've been able to move so far.
Thank you so much. Ms. Cisneros or Ms. Keene, if there's anything you'd like to comment on in this topic.
Yeah, I just wanted to say that I was very glad that in your report, there was a mention of the aging farm worker population in general. That is certainly an issue that a lot of people are paying attention to. With increased age, of course, comes increased health issues as well as increased healthcare costs. So that's something that workforce-wide, right, statewide, California will need to pay attention to. And then finally, of course, the expansion of Medi-Cal to more people is particularly important for the farm worker community because, as you mentioned, a large force of the farm worker population is undocumented. And really, it's, as Dr. Arambola has stated previously, it's really going to take an effort from all parties, right, involved, employers, CBOs, healthcare centers, just trusted partners in giving that information to eligible people to encourage them to enroll because for a long time they were not able to. And that isn't just for the undocumented population, but also for just, you know, through the ACA, just increased expansion of the availability of medical coverage.
Thank you. Those are great perspectives. Thank you so much for chiming in. I want to turn a little bit to the future and ask you what possible changes to policy or practice on the ground do you see as most important for improving health and safety for farm workers going forward? And Ms. Keene, I'd like to get your thoughts on this first.
Absolutely. So AgSafe, we're a non-advocacy organization, but we work with our regulators and our industry and try to be that conduit in between to get the two talking. And so honestly, in moving forward, I think that communication is critical to making policies that work and meet people, again, meeting people where they are, and really looking at the boots on the ground approach and what makes sense for our industry. Ag is a little different than all the others. And so just having that mindset as policies are created, that this industry is really critical to the well-being of our state and our nation and worldwide. One of the other things I like to also mention too is we talked a little bit about aging workforce, and we are also facing a major labor shortage as well. And so the industry is really looking to technology to help with some of those issues and then also really protect our workforce. So what are some innovative ways in which we can make the job easier? So we're looking at autonomous tractors. We're looking at these AI platforms that are in the fields. And so this is the best part. In some of the vineyards, you're picking in your row of grapes and you've got your bin, you put it on this platform that takes your grapes to the truck. And so you're not bending down, you are not having to carry it back out to the road, to the ag road to, get rid of your grapes and put them in the truck. So thinking creatively about those kinds of ideas. And we really need some help with our regulations and making sure that the regulations meet that technology, that we're able to do the investigation to make sure that that technology is safe for our workforce and how we can get it implemented. So those are some of the things that it would be great in moving forward.
Wow, I had not realized that there were also driverless grape trucks out in the world. This is fascinating. Yes, thank you so much for bringing up the role of technology. That's a great perspective. Ms. Cisneros, is there anything you'd like to add?
I think for us, certainly an important part as well is always in enforcement, working closely with the relevant state and federal agencies to actually implement the safety standards and protections that already exist and that we can rely on to increase the health and safety of farm workers in the workplace, something that we're always very supportive of.
Dr. Arambola.
I would point out within the PPIC report, you state that cost and access to healthcare is the primary barrier for healthcare for our undocumented community. And so for our undocumented community who do not get employer insurance, they currently are barred from our public insurance. And so I believe it's absolutely necessary, in addition to passing the budget that we have, for us to sign into law AB4, the Health for All bill, so that we can end the unjust exclusion of our undocumented community from being able to access healthcare. By simply making it those who are income eligible and recognizing that healthcare is a human right for our community members, we're acknowledging that all members are essential. For us to have food security for our nation, we need to be supporting those who are helping to deliver that food to all of our tables. We would not have the bountiful harvest if it was not for the hard work of our farm worker communities. And I am hopeful that the governor will sign that bill when it gets to his desk this year. But would also point out, if I can, looking into the future, the need for us to address the climate change that's coming, the extreme heat events and the worsening air quality for some of the air basins that are the worst in the entire nation. That last year in Fresno County, we had the most number of bad air quality days in our state, and that our farm workers who are out in the midst of the fields and wildfire seasons are continuing to expose themselves. I look forward to conversations on how we improve the air quality in the San Joaquin Valley on a bill 2550 that I'm carrying this year, and would point to much of the work that Assemblymember Luz Rivas is doing and some of the work that I'm doing in looking at extreme heat and the effect that it has on our community. I think those are real opportunities for us to make improvements as we go forward. And I'm grateful that these legislation are working itself through the process right now.
Terrific. Thank you. Thank you for those thoughts. So we would like to turn now to questions from our audience. Let's see. Our first question comes from Dr. William Bronston, Physicians for a National Health Program. And Dr. Bronston asks, what changes, if any, must be made to build a competent health workforce to meet the agricultural workforce in the rural health deserts to meet the health and safety needs of the vast underserved population?
I'll start because that's a little close to home. I mentioned I was an ER doctor. I spent 10 years in Selma. It's the raisin capital of the world. It's 10 or 15 minutes south of Fresno. And I saw firsthand how hard it was to recruit providers to areas of the state where they didn't train and grow up. And so realize that we need to change our mindset for how we can recruit and retain those providers, and believe it starts by growing our own. And so I've been working diligently to bring a medical school back to the Central Valley so that we can have our own students stay locally. We've been successful in starting some of those cohorts with UCSF and through Fresno, and I'm working on a transition eventually towards UC Merced to develop that medical school to train our own who can stay here in our community. Would also point, if I could, to some of the work we've done as a state towards international medical graduates, those who have cultural and linguistic competencies, who make commitments to come back to some of our underserved parts of our state, like the Central Valley, are real opportunities for us to take some of those providers and allow them to practice in our backyards. I'm pleased that they have been making those choices and we've been making advances, but it never happens fast enough. We have about half the number of doctors in the Central Valley as they do in San Francisco. We have about a third of the number of psychiatrists as they do in the rest of the state. It's hard for us to address many of the healthcare needs of our communities if they don't have people to go and see. It was personal and I was on the front lines. And so I'm working diligently as well to make sure that we're resourcing and providing opportunities for people to come back to our underserved communities.
Other thing I'd like to say, and one of our questions is what gives you hope for the future. And just yesterday had a great call. This is an example from the health department up in Siskiyou County, Northern California. And we are now having conversations like, COVID brought us a lot of things, but one of the things that it did bring us is that we are now talking about people's health a lot more and really taking it seriously. And so the health department up there was looking to figure out how to expand their offerings and talk to farm workers about their health, and not just about COVID, but women's health. Can we talk about diabetes? And so that is one of the things, the surprising thing that's come out of all of this, is now that we're starting to make some connections. So we've got a health department that's reaching out to the ag employers, talking to the ag commissioner. And so starting to get that dialogue going and figuring out how to get resources to the people that need it the most. So that is definitely one really great thing that I've seen come out of this.
Thank you. I'm gonna move to the next question. This comes from Joel Diringer, who writes from San Luis Obispo. And Joel asks, what are the policy opportunities for expanding health coverage for farm workers in the areas of Medi-Cal and employer-supplied insurance?
I would just point to the 200,000 elders and seniors who had expansion opened up to them in May and need to now do the work of implementing and actually getting them enrolled. And the opportunity that by January 1st of 2024, it's up to 1 million Californians who we can work to enroll who are income eligible. Those are the opportunities before us, but again, would point out the policy vehicle is AB4, so we can end the unjust exclusion. It's the budget that pays for it that we will be voting on next week.
Ms. Cisneros or Ms. Keene, would you like to add anything? This next question is for me, and it comes from Patrick Blacklock from the Rural County Representatives of California. And Patrick writes, my understanding is that the County Medical Services Program, or CMSP, offers both preventative and emergency health care coverage for undocumented workers, including farm workers in 35 rural California counties. How did your study evaluate the data associated with CMSP's Connect to Care and Path to Health programs? Did your study identify strategies to increase enrollment within these already existing programs? So, Patrick, unfortunately, the study that I used, the study data that I used, which was the National Ag Worker Survey, in the public version, there was no way to disaggregate by county. So I was unable to do any county level specific analysis. I would point you to a previous report that came out last year. And I think the title is something along the lines of coverage and care for undocumented Californians, an update, or some possible scrambling of those same words, in which we do get a little bit more into what's available county by county, including those county programs for the medically indigent, such as the ones from CMSP that you refer to. But for this study, unfortunately, I wasn't able to dig down to the county level in terms of enrollments or in terms of increasing enrollments. It was really more a look at some of the larger federal expansions under the ACA to both Medi-Cal and employer coverage. And then our next question is from Steve Manig-Pitt from Western Growers. And Steve writes, my understanding is that during the public health emergency, Medi-Cal beneficiaries remained enrolled regardless of any changes to income. Assuming the public health emergency ends at some point in the future and DHCS, Department of Healthcare Services, starts disenrolling beneficiaries from the program that no longer qualify due to increases in income, do you see that as a force that might materially contract the size of Medi-Cal and shifts enrollment to the exchange or to employer-sponsored plans? Dr. Arambola, is that something that you would feel comfortable speaking to?
No, I will. Redetermination, which is the underlying principle he's speaking about here, which has been delayed due to the public health emergency, is going to be a major undertaking. We're taking at the state and county levels to make sure that we get adequate and accurate information on whether your income allows you to continue to be eligible to be on Medi-Cal. We are expecting the workload from the redetermination to be significant, and so really have been working to resource. The attempt from us is to make sure to have as much continuity as possible, and so we'll work diligently with our county partners to do this redetermination, but have been working closely with DHCS in anticipation of this date so that we can adequately resource and prepare as best we can.
Great, and I'll just add that I believe PPIC had a blog post around, I think, March of this year that does discuss the redetermination potential changes once that does start to occur again, and references a national report from a think tank that does some projected changes to Medicaid across the nation, including California specifically. So I would also direct you to that post and the links that are embedded. Okay. Ms. Cisneros or Ms. Keene, is there anything you'd like to add on this topic? It's fine, it's fairly specialized. So let me actually give our panelists an opportunity now to add anything else on the topic of farm workers' health and safety. Oh, I'm sorry. Before I do that, I have another question from the audience. My apologies. This comes from Ellen Wittes, UC Merced Community and Labor Center. And Ellen writes, how can we continue to use and support CBOs in serving farm worker communities? We have seen significant success using this model. Let's see, Ms. Cisneros, could I turn to you to start us off?
Definitely. I mean, first, just wanting to continue to support and work with CBOs in serving the farm worker communities is a really important acknowledgement. It's really CBOs that are on the ground with farm worker communities, not just farm workers, but their families as well, in a way that other organizations or entities may not be able to. I mean, I think we saw great success we've been seeing great success in the dissemination of information by partnering and working with CBOs in a variety of settings, the census, vaccine efforts, COVID protections, really a large variety of different, very important. And before that, of course, the expansion of the ACA and enrolling people in the ACA. And so really kind of first getting to know who the CBOs in your community are is an important first step. Simply asking to meet with them, finding out from them what they're seeing, how they want to be supported. Each CBO is different. They may need different things, and really just kind of finding out that information and providing the support that you can. Each organization or entity may be able to provide different support. Somebody from a labor center may be able to provide research assistance or, elevate a certain public policy issue or, spread the word on something versus another entity may be able to provide different kind of assistance in a different way. So it's, we've really found that because really investing in trusted organizations based on the communities that you're trying to target, that's really critical to having that trust and really being successful in disseminating the information or meeting your objective with whatever it is that you're trying to address or target.
Thank you. Dr. Arambola, were you interested in speaking on that topic as well?
I see Teresa has her mic open. Would love to.
Oh, I'm so sorry.
Okay. Thank you, Assembly Member. So I think one of the other ways is like state of California, keep funding us to do this work. We had a pretty good influx of some funds that came in through COVID-19, but we all know, again, through all this work, there's more to be done. And so, keep funding those CBOs to do the work they are. Again, it takes many voices to reach our population. And we also understand, the challenges. And so, just being able to be flexible with the work that we're doing and just allowing us to keep doing that education outreach, which is so critical to ensuring that our farm workers go home at the end of the day, safe, healthy, and whole.
I would add, if I could, I really want to uplift Cultiva la Salud and Leadership Council for Justice and Accountability, who were the CBOs during the pandemic I was partnering with. But that experience really made me become an advocate in trying to bring resources to support those organizations as well. So I'd point again towards 2680, our bill to have community health workers and navigators. I'd point towards the effort that the state to support promotoras and to hire 25,000 community health workers by 2025. And ultimately, I'd point towards the Assembly's efforts in HERGE, the Health Equity and Racial Justice Fund, a fund to help CBOs to succeed that we've been pushing for the last 2 years. I think it's important for us to fund those boots on the ground who are doing that hard work and have become a strong advocate for them up here at our state capitol.
Great, thank you. And thanks for all of those call outs to the CBOs. That's really great to hear their names being mentioned in this discussion. I have one more question that I'd like to get to. This is from Noe Paramo from CRLA Foundation. And Noe asks, can you tell us with certainty how many farm workers would actually be covered under the Medi-Cal expansions given the income limits?
I will give us our best estimates as the LAO has helped to prepare them for us. And it's approximately 200,000 elders and seniors over the age of 50. And it's approximately 1 million Californians who will receive coverage by January 1st of 2024 to get us towards health for all. And Noe, it's great to hear from you and have your question here in this format.
Thank you. And I'll just add to that, the proportion that are specifically farm workers. I think that there are some a range of estimates out there. In the report appendix, I do have some estimates using the American Community Survey about who is likely to be a farm worker. In talking to other experts, I have heard that those estimates are likely to be underestimates, just given that this is a very hard to count community and could be substantially an undercount. And so I would say that the numbers in the appendix, which are on the event website, would probably be kind of like a floor on an estimate of how many farm workers would potentially qualify. But if there are specific cuts of those data that you're interested in discussing, please drop me a line and I'd be happy to do some analysis for you. Okay, we just have a couple minutes left in the program. And so I just want to go around to our panelists and give you each maybe 30 to 60 seconds to tell us if there's anything else you would like to leave our audience with on the topic of farm workers' health and safety. Ms. Keene, could I start with you?
Of course. Sounds good. You know, we've talked a lot about today about farm worker health and safety, which is really exciting that this topic is coming to the forefront and people are paying attention. And so that's actually one of the things that I'd like to, make sure that we continue to put our emphasis on. We saw through the pandemic, we have an essential workforce and an essential industry that we need to make sure that we take care of. So I don't want the conversations to stop. I want us to keep having these conversations and figure out ways that we can support the industry, support our workforce, and make sure that we get to continue to feed the state, the nation, and the world.
Excellent. Ms. Cisneros.
I think the last note is that I wanted to end on was simply, this is a really important long-term issue. And I'm really glad that there's organizations and many partners that are working on this issue, looking at it, researching it. It's certainly not an issue that's going to be resolved in anytime soon. I would hope that I am wrong, but it's going to be an ongoing issue for our farm worker community. And so raising awareness and really dedicating ourselves to combating it is something that organizations like myself would always support.
Thank you. And Dr. Arambola.
First, I'll just say thank you to the entire panel and to Paulette for bringing us together and for holding this forum. I think it's important for us to have this conversation about the needs of our farm worker communities. 30 years ago, our state led and started with Prop 187, taking away many of the public resources for our essential community members. And I'm pleased that our state has now progressed to the place where we are, that we acknowledge and give each and every member of our community the dignity and respect that they deserve. I'm grateful that we've come so far, but no, we still have so much further to go. And I'm thankful that this panel is able to give some thoughts to those tough questions and for everyone being here today.
Thank you for those uplifting comments to our panelists. We have reached the end of our program. I would like to thank our panelists for joining us today. And thanks again to our funders and to all of you for joining us today online. If you pre-registered for this event later today, you will receive a survey. We would appreciate if you would take a few minutes to respond and let us know how we did. Stay safe and have a good afternoon.